All right, well, I think we'll get going. So good evening, everybody, and thank you for joining us tonight for our webinar. My name is Megan Landry, and I'm the Program Manager for the Health Informatics programs at the University of New England. With me tonight is Holland Wagner, who is one of our enrollment specialists, and you'll be hearing from him a little bit further in the presentation. But thanks again, and we'll get this show started. Just a couple of housekeeping things to start off with. The webinar is being recorded, and by continuing on with this webinar, you're accepting that you're part of a recorded process in which will be used for future students. I'm going to talk for probably around 15 minutes or so. Just a few slides to talk about a little bit about our program, and then a kind of a story around the day in the life of a clinical analyst. And then at the end of that, we're going to have a Q&A session. When we've done these in the past, we've had a lot of questions, and I can speak for both myself and Holland. That is our favorite part. We love talking to folks, so please feel free to ask your questions. There's several places that you can do that. On the right-hand side of your screen, you will see the questions section. You can type your questions in there, and Holland and I will answer them. You can also raise your hand right next to your name on the, hard to know what it looks like for you, but on the right-hand side, you can kind of raise your hand. What I'll do is I'll kind of tell you that I'm gonna unmute you, and then you can ask it out loud, and we can have a conversation about that. And then lastly, you can type something into the chat box if you had another issue, and we'll be looking at all of those things as we go through. So get your questions ready. And we'll get going a little bit further. So just right off the bat, wanted to talk about our programs. So we offer a master's degree, which is a 36 credit hour program. You can complete it in as few as 2 years. We don't require any campus visits. It's 100% online. You don't need to do the GRE for admission. That is not required. We do, most recently, are now offering 3 optional focus areas. I'm going to talk about those a little bit more in a few minutes. And I do like everyone to know that we are a regionally accredited university, so we're NEASC accredited. So the next thing I wanted to share with you is our program outline. This is a list of the classes that you would need to take if you were in the master's degree. The one thing I want to kind of pause and point out here right now is that if you're interested in the graduate certificate, you would need to take the first 6 classes on this list. So 1, 2, 3, 4, 5, 6 classes down to this 625. You would take those, and then you could have your graduate certificate. What's nice about the way we designed this is that once you finish those classes, if you're interested in going forward and completing out the master's degree, it's a pretty smooth process. It's really just a form saying that you want to do that. And as long as you're in good standing with the university and the program, it's pretty easy. You don't have to reapply, and we take all your credits. So we set that up to kind of make it as easy as we could for you. So to talk through the classes, because I get pretty excited about them, our first class is kind of an overview of healthcare. I know many of you already work in healthcare, but I think it's important to kind of stop and take a look at what healthcare is now and kind of how we got here. We do a survey course on, kind of what is health informatics. We talk about healthcare quality, because if we're not improving the outcomes for ourselves and our patients and our communities, then I think it's kind of all for naught. So that's important that we talk about healthcare quality. Then we do a kind of a intro to computer science program for folks. That's always fun, a little bit more hands-on. Then we do a database class, which is very hands-on. It's a technical class. You would be learning to use SQL. Students really like that because it's hands-on. There's actually activities to do every week. Very, very exciting class. Then there's the 625 class, which kind of bounces back more to policy, privacy, and security. Those are kind of those things that we all have to, get through and learn about because they're very important to the work that's done. Project management course is another popular class. You know, project management concepts can be used in almost anything you do, no matter what your job. And people usually really gravitate to those concepts once they've finished the class and utilize them in their day-to-day life. Our 7:15 class is a data visualization class. So taking data, analyzing that data, and then making visualizations. What's fun about this class is that you actually get to do visualizations in Tableau. Tableau is kind of the leader in visualization software. And it's kind of fun to make really interesting and effective communication tools with charts and graphs. So that is another challenging, hands-on, very engaging class that students really love. At that point, folks switch into 2 electives. We have a list of electives. I'm going to talk about how that feeds into the focus areas in a few minutes. And then we kind of wrap it all up with our final capstone experience, which is the final 2 classes, which are a practicum or project experience that is really going to sum up everything that you've learned in the program, can oftentimes really get you in a good place for a career or a change in careers. So our 3 focus areas, and I kind of point these out because these are new. The way we work it is if you want to take general electives that we offer, you can take that, and we would call that kind of quote unquote a generalist path. You can choose whatever electives that you want, whatever kind of works into your course map is fine, or you can kind of choose all the options you want. But if you were particularly interested in any of these areas, we would kind of guide you and recommend some electives that would line up for you. So we have the healthcare leadership focus area, and there you would take classes on leadership, finance, budgeting, those type of things. It's 2 classes to prepare you for leadership. Then there's the data analytics class that will be a foundations and then advanced concepts in data analytics. This is really for folks that are purposefully interested in seeking out data analytics jobs. It's a rigorous focus area. We're really excited about it. It's going to be very hands-on, and it'll really prepare you for a huge part of this subset of careers in this field. And then finally, for those that are interested in the realm of training around electronic tools, there's the training and development class. We've partnered with our folks in the education department to offer an adult learning theories class, and then also a communications class where you would learn advanced concepts in communication around writing, presentations, and oral communication. So learning to really reach out effectively to train the adult in, you know, EMRs or, you know, whatever the tool might be. So enough about the program, and kind of why many of you signed up tonight is to talk about what is a clinical analyst. So a little bit more about my background. I'm a nurse. I worked as an emergency room nurse for about 12 years, and then I moved on to be a clinical analyst and then a clinical informatics manager, where I hired a bunch of clinical analysts here in Maine. So I know a fair amount about the role. So what I'm going to kind of do is tell you about it, and then I'm going to tell you about my experience in the work that I did, so you have a sense of what that type of work could look like. It's just an example. It's just one person. It's going to be different across the country, but it is relatively what we would see here in Maine. So when I was an emergency room nurse, it was back in the day where we had clipboards, and the clipboards were great, except only one person could use the clipboard at a time. So you were very limited in the amount of knowledge you had. And this really stymied the flow of emergency departments in our country 10 years ago, let's say. I became very frustrated with the lack of information sharing at the time because of that. And it really piqued my curiosity, and that's where my interest in improving workflows and clinical outcomes and patient safety through technology. So I became part of the implementation team that was putting in the EMR at the time, specifically around what we call a tracker, an ER tracker. From there, I went on to get another job in the state as a clinical analyst. And I was hired by a large healthcare system here in the state of Maine to manage the electronic health record system for all of the emergency departments in that system. And I think there was about 7 of them at the time, ranging from very small systems to very large systems. So a 3-bed ER all the way up to, a 25-bed ER. And I was responsible for overseeing that. So when we talk about, what is a clinical analyst, as a general rule, and I know there's exceptions to this, they do tend to be folks that have worked clinically, have worked in that field, whether it's a hospital or a clinic or a physician's practice. They are often nurses, physicians, respiratory therapists, pharmacists. I'm not excluding anybody with that list. It's just the few that came to the top of my head. But it's folks that know the workflow, really, and the ins and outs of how day-to-day work goes in that particular area. Where do they work? For the most part, it's hospital and physician practice settings. Again, I know that there's lots of other examples out there. So what do they do? Probably the most important thing they do is they maintain the system, maintain the module that they support. So in my case, I was responsible to make sure that these trackers and documentation systems for all of these emergency departments continue to run smoothly. So I would look at them every day, I would analyze them every day, making sure that everything was looking as it should. So that was kind of the number one thing I did. We used a product called Cerner. There's a lot of different electronic health records out there. Just kind of as a side note, the health informatics program at UNE will not teach you about all the different EHRs. So we aren't going to train you in Cerner and Epic and Eclipsys and eClinicalWorks and all of that. Most of those companies wouldn't allow it. They like to do their training themselves. And B, we're really more about bigger picture, like how to configure these systems in ways that are safe, effective, efficient, those type of things. So we're almost a little bit above that. So just want to kind of put that out there. But at the time, I had learned how to use the Cerner system. So when a person that uses the Cerner system, say a physician or nurse, has something that doesn't work while they're using it, they would put in a help desk ticket. And then I was responsible to take that ticket and troubleshoot why that person was having a hard time. Is it that they don't understand how to use the system? Is it that there's something wrong with their computer? Or is there something wrong with, the board and Cerner and so forth? And so that was a lot of fun because it was a bit of an investigation process to kind of figure out what's wrong, to solve the problem, to escalate the problem. That was always kind of, could be pretty exciting. I will tell you, most often it was the almighty user error. And oftentimes we could get folks on the phone and we could talk them through the steps that they were missing and they would be fine. In these systems, they're always doing upgrades and adding new functionality. So you're learning about that functionality and then you're planning for the implementation of that new functionality. Back when I was working, we were putting in something called CPOE, which stands for Computerized Physician Order Entry. So it's back when we were getting physicians to put their own orders in instead of writing them. And you can imagine that there was a lot of pushback. Doctors had been writing orders for centuries and they weren't particularly interested in changing at the time. But we were going to get that done. And it took a lot of help. We had project management teams. So we would sit in project management meetings. We had training. The other thing we did is that we'd meet with the stakeholders. So going back to the CPOE example, we would meet with physicians, cardiologists, and would say, what could we do to make the system work for you with your workflow based on what we can do in this system? And we'd kind of show them what their options were, and we'd kind of negotiate what they could do, and we would kind of, hold them in check and balance if they asked for something that wasn't particularly feasible. So we would kind of be a bit of a liaison and a mediator in those meetings, which could be really collaborative and fun, but sometimes challenging and frustrating. It was always very interesting. And then when it was time for the new functionality or the new system, you built that. And you would get training from the system, but you would do it, you do it in a training environment first, in a testing environment, and then in the live environment. It was always very exciting. Then there was always a lot of testing. So you would work with the other analysts and make sure that the system worked perfectly, because it had to. These are patients and people's lives on the other end of this system, and it had to work perfectly. So we would always do a lot of testing. Then there was always the go live day, which was very exciting. And we would be there in the middle of it to help our colleagues through when these new things would start, would help walk through it, would answer the help desk calls. And then if things didn't work correctly, we were responsible to fix them. So that's kind of like how my days would go, and no day was ever the same. I oversaw a staff of about 15 clinical analysts at one point, and every day had its ups and downs. We were always planning for a new implementation of something, but then every day we were also taking care of whatever little buggy thing seemed to happen, or problem that arose, or planning that needed to happen. The last thing I want to say about clinical analysts is, this program would help prepare you to be a clinical analyst, but even above and beyond that, because I'm guessing many of you do that role now, it would help prepare you to be the leader of those clinical analysts teams. So the program really is, like many master's degrees, it prepares you for the next level, for leadership, even if you don't take the leadership track. It's making you look at bigger picture things, not this is how you do it, but this is why you do it, and this is what you should think about when you do it. So it's a lot of bigger thinking and theory and analyzing the whys of things, and that's pretty common in graduate education. So I think I covered everything that I wanted to cover here. We're going to kind of shift gears here a little bit. I'm going to toss the mic over to my colleague Holland Wagner, who is our enrollment counselor. He's got some things to say, and then we're going to open it up for questions. So bear with us as we transition here. All right, Holland, you're unmuted, so go ahead.
Good evening. Can everyone hear me all right?
Yep, that sounds great, Holland.
Perfect. Well, thank you all who are in attendance today, and thank you, Megan, for some great insight on the program and also what it's like to live in the field of informatics on a day-to-day basis here. I think that's a very useful perspective for a lot of you who are trying to get a grasp of whether this is the right program for you, whether this is the right fit for you. So I kind of wanted to start by, telling you all what we're looking for in an applicant, really. And, we do really recognize that health informatics itself, it's rapidly evolving, it's always changing. And, we have a lot of applicants from a very diverse backgrounds that are drawn to the program. Students really who are successful have rich backgrounds in a variety of professional and academic experience. So, I did want to note that obviously not all of you are looking to be clinical analysts. That's just, what Megan did for her career is a very small sliver of what the field of informatics is. There's all sorts of opportunities out there that she can, attest to in project management, data science, and population health, telehealth, clinical education. The list really goes on. So there's no one typical background that we're looking for. Really, we're looking for a successful student that has, lifelong curiosity, natural perseverance, and inclination to take on new challenges. We want people who are ready for that leadership role, ready for the next step. And, really people who have that ability to learn, to adapt on the fly and use those new tools, the technology, and kind of implement that. And, we really want students that have the capacity to manage multiple competing priorities. And we find that they're typically the most successful, especially in an online learning environment here. So at this point, we are accepting applications for both the summer and the fall. Summer would be the next time for anyone looking to get in. That will start up on May 2nd. As you can see at the bottom of the slide here, the application deadline is April 9th. It's a couple months out, but that always comes up a lot quicker than people assume, and I just can't emphasize enough how beneficial it can be to have everything in order leading up to the start date of the program. But that's my take, and from here we really want this to be about you, your questions, ranging from anything about what Megan spoke to about being a clinical analyst, careers in general, the application process, anything like that. So we'll turn it over to you, and please raise your hands and use that question bar or the chat bar to answer or to field any questions that you'll have.
Great. Thanks, Holland. That was helpful, informative. So I'll give folks a few minutes to enter any questions they have. I know you have questions. People always have questions. So we'll just let that one first brave soul be the one to do it. Okay, great. We have our first question, and it is, how long are the classes per semester? Great question. So the typical way that it goes is that you take 2 graduate classes a semester, and they are 8 weeks at a time. So you would take one 8-week 3-credit graduate class, and then a second 8-week 3-credit graduate class. What's nice about that is that you are 100% focused on one class at a time. It does get, busy. They're graduate courses, so they're busy. They go by fast, but you aren't distracted by multiple different kind of processes or thoughts out there. It's one at a time. Hopefully that answered your question. And then we have another one. What is the platform that you use? We use Blackboard. So that's the learning management system that we use. Your classes are 100% on Blackboard, and you would do your papers, discussion boards, presentations, all of that right in the Blackboard system. All right. Great. I love to see the questions. They're coming in, so let us kind of process them. So another question was, does the certificate program start at the same time? Holland, do you want to answer that? And I can keep an eye on the next questions coming up. Let me unmute you. There you go, Holland.
Here we are. Yes, the answer is it does start at the same time as far as the master's program goes. We have 3 entry dates a year, so we do accept for the spring, the summer, and the fall. So the next entry date for the certificate program would be May 2nd, the same start date as the master's program here. Following that, you'd have a fall start date, end of August, August 29th. Followed by the spring, which is the start of January, looking at January 3rd at this point. Our application deadlines are typically just about a month in advance, about 3 weeks. But again, I really can't stress enough that you want to give yourself some extra time here. The earlier you apply, the admissions committee likes to see it, likes to see people who are forward-thinking, people who are really looking to take the next step and have plans in place, and B, it really gives you that extra preparation time that's necessary to, secure financial aid if that's what you're looking to do, to order your books, to work with your student support specialist as far as course mapping goes. So definitely beneficial to, do it sooner rather than later. We have rolling admissions here. So say we were to have all of your application materials in today, you'd likely hear an admissions decision with in about a week to 2 weeks time. So it gives you plenty of time to plan ahead there.
All right, Holland, I'm not sure if you know the answer to the next one off the top of your head, but.
Yeah, we have another question here asking, if you enter the program in May on the summer start date of May 2nd, what's the expected graduation date? That'll depend a little bit based on the student. If you follow the typical path, taking 1 course per 8-week term and 2 courses per semester, the graduate certificate will be completed in a year's time. It's 6 courses total, and the master's degree in about 2 years. So that would be 12 courses total, and it can vary. Part-time's an option. Say you needed to take a term off, ever take a leave of absence. That's something that we could work out. And again, you'd have a dedicated student support specialist upon acceptance in the program that can help as far as course mapping goes. Accelerated coursework is also an option. So if you did have the extra time to dedicate, you could double up on certain courses. We do recommend that you dedicate about 15 to 20 hours per week per course. So do keep that in mind. But for those who either are working part-time or super dedicated, or just know that's something that they can get done, that's an option as well.
Great, thanks, Holland. The next one I can take, it says, is there any help for Blackboard? So when you are enroll with the program, you would be put into student orientation. And so the orientation that you would do is in Blackboard, which is kind of nice because you kind of get the hang of Blackboard, and it gives you activities so that by the time you started your real class, you would know how to upload a document, how to submit an assignment, how to look for feedback on the grades, how to post a discussion board post. I will say most people, by the time they get through that and start the program, they may have questions, but it's not typically about Blackboard. So I wouldn't be too worried about that. The next one, do you feel as though getting the graduate certificate decreases your opportunity for jobs compared to getting your master's? These questions are always tricky for me because I don't want to, it really depends on your background. I would say that oftentimes the folks that are getting graduate certificates are people that already have a master's degree in something else. So they have a master's degree in nursing, or they have a master's degree in public health, and they want to get the health informatics knowledge without doing a whole nother degree. If that isn't your case, then we would typically recommend folks to do the whole master's degree. But having a graduate certificate certainly always would look better than having nothing to an employer. So I think you can always start with that and then add on and go from there. All right, so the next question, how many learning hours are in 1 credit point? What is the self-rating ratio? Okay, I'm not entirely sure I understand the question, but it's 3 credit hours per course. And like Holland said, it takes about 15 to 20 hours. That really depends on a lot of things. It depends on how quick of a reader you are, how quick a writer you are. It really depends on a lot of things. So that's kind of just a rule of thumb. If I didn't answer your question correctly, try rephrasing it so I can understand a little bit better. And you're also welcome to put your little hands up and I can unmute you and you can ask the questions yourself. But for now, I'll kind of keep going down this list. The next question is, since you said that the platform uses Blackboard, do you use proctored exams? Good question. We don't, because we do not do straight up didactic quizzes and exams. We do more assignments that are submitted. So papers, there's a lot of paper writing. That's part of most graduate programs. In the technical classes, you would submit screenshots. You would submit, oftentimes, you would show your instructor what you're doing, like almost like a screencast, and you would submit that. And then some presentations, not a ton of presentations. We do a little bit of group work, but not a ton. So those are the things that you would submit, but there aren't any straight up tests or quizzes. The next question is, if somebody is coming from an IT or computer support background rather than a clinical, would the class path be different? The class path would not be different. This is kind of our standard curriculum. You may think about things differently around electives, and we could certainly talk about that. I think if you're coming from an IT background, there's probably one course that would probably be a bit of a gimme for you, and that would be the computer science class. That knowledge I'm sure you already have, but consider that a chance to catch your breath and get a solid A and help that GPA. Other than that, the curriculum would be the same. Are there a limited number of slots available for the program at each start date? Holland, do you want to answer that one?
Yeah, I'd be happy to. We have at time, had to split, cohorts into multiple sections. So I guess the answer to that is at this point, no. We do purposely keep the class sizes small, so you're not going to find that, you have a course with, say, more than 10 to 15 people in each course. We want to give each student, the time that they deserve, and also that develop, those student relations with your fellow students there. There's a lot of that we try and build into the program, being that we're an online program. We still want to give students a sense of community, so we really try and foster that throughout. So there's going to be a lot of opportunities for you to, respond to others' discussion boards and all that. But to your specific question, the answer is no. But we have had at times, if the cohort is going to be a larger amount of students, to split it up into multiple sections, if that makes sense.
Great, thanks, Holland. Last question here, but we'll stay on. So if you have more, go ahead and add them. It says, do you help students find jobs in the clinical analyst field after graduation? We don't help you find jobs. We do have a career, I'm not going to say the office, right? A career planning office at UNE that has some resources. I am happy to talk to students and give them advisement about jobs in general. But as far as matching you, like technically matching you up with an employer, that would be pretty hard to do, since it's a national, we reach across the nation. Actually, internationally, we have some international students as well. But I am always happy to talk to students about job advice, I guess is probably the best way I can say it. The other thing I will say about that is that when you do your practicum experience, and you can do a practicum or a project, oftentimes if you work within a company and that experience goes well, they oftentimes will work into jobs. That's why, even though these practical experiences can be challenging to find, it's worth it, because if you go in and you are a rock star, then very often they'll offer you a job, or you're on the list for the next job that comes up. That's what I would say about that. Let's see, we got another question. Great, keep them coming. Can you talk a little more about public health informatics, including the types of jobs in that particular field? Sure. The University of New England has an online public health program, so I talk to my public health colleagues a lot, so I feel comfortable about this one. Public health obviously is the health of the public, and where informatics sometimes can insert itself in many ways, but the public health field depends on the data that they get, getting that from us to some degree, but that the data is what we call good data or clean data. What has happened is that many organizations have put in systems that collect data, and they did it in the best way they knew at the time. But oftentimes under tight budgets and maybe haphazardly or under the gun to get it done quickly. And so they put the systems in and they didn't really understand how they were collecting data. So the data can be very unhelpful in the end because it's not really gathering what you want to gather. So what often informaticians can do is we can be involved in collecting data and designing the tools to collect the data that is going to be really effective. If you're getting numbers to, the example I always use, if you have a set amount of money in the state to work on childhood obesity, you want to target that money to the counties that need it the most. If we aren't collecting that data appropriately, then you're spending your money on the wrong places. So there's a lot of crossover. There's a lot of collaboration in these fields. There's certainly the subset of straight up public health informatics. Biostats and epidemiology can all sort of blend together as roles around collecting, analyzing, interpreting data. They can be very similar in some ways, but we definitely are going to be more on the helping to install tools that are going to collect the data well, work well for the person using the system. A lot of workflow design, user experience design is involved, and making sure that you have the best data possible. I hope that answered your question. If it didn't, feel free to reach out and we can set up a time to talk in detail. I'm happy to do that. Looks like we have another question. This is the last one, but feel free to add more. Not sure if you would know, but is the laboratory science program available online as well? We don't, I don't think we offer that. Help me out, Holland.
Latricia, you might be referring to our science prerequisite individual courses. You can find more information about that on our website under the science prerequisites tab.
Okay, great. Sorry about that. Thank you. All right. It looks like those are all the questions that we have. We'll hang on here for a few more minutes. So if people wanted to raise their hand and ask a question or type it in, we'll be here for a few minutes more until we'll wait you out. So again, you can see on the screen how you can find out more information. You're welcome to reach out to Holland and talk to him if you have particular questions about the field, jobs, your background. I'm also available to talk to, although my schedule's a little bit more difficult to wiggle into, but always happy to talk to folks if I can. So on that note, have a wonderful evening, and we'll be here for a few more minutes. All right, folks, we'll probably give it a couple more minutes. I'm not seeing any more questions coming on, but I see several of you still logged in. So kind of last call on questions. We're happy to hang out on the call, but if you don't have questions, we'll get on with our evening as well. So go ahead and get those questions in now if you have been waiting.
And please feel free to reach out to myself, my fellow enrollment counselor, Jeff Nelson. We're always there, an email, call away. Happy to answer any questions that you have. You have our contact info on this final slide. Please jot down, reach out to us. For all those in attendance, we're also happy to waive the $40 application fee. So just follow the link below, get in touch with us, and we'll walk you through that process as well.
There is one other question about the cost. There's no difference in cost between American and international students. It's the same cost.
That is correct, Megan. Yes, it would be it's the same cost. We're an online program here, so there's no in-state, out-of-state, in-country, out-of-country cost differential. So it would be the same cost for each program.
Okay, one more question. Great, thank you. Have you known any students that don't have the clinical background and coming from IT, do they succeed? Do you mean that they don't have clinical or IT, or they have just IT? You can just ask a second question. Just IT. Oh yeah. You know, that's definitely been my experience, both in the program and working as a clinical analyst. Oftentimes, it's usually clinicians that go into informatics and pick up the IT skills, but there is certainly a group of IT folks that every year would kind of transition into the analyst jobs. They had a little bit more of a skill and knowledge gap. So having a program like this would be a great way to fill that. As a hiring manager, seeing that IT background and then the courses that are more kind of clinically minded, not more, but would fill in that gap, I think would be really, really appealing to employers. You're welcome. All right, folks. Well, on that note, we're going to wrap it up here tonight. Thanks again for taking the time out of your busy lives to listen to us. Feel free to reach out if you have any questions. We're always available, and I hope to see a lot of your names in the future. Thanks, and have a great evening. Oh, one more question.
Terelis, we are accredited.
Yeah.
We are regionally accredited by NEASC, the New England Association of Schools and Colleges.
You got it. Oh, I almost missed it.
Happy to help.
All right, folks. Have a great evening.